One of Pat Breidenbach's true joys was singing in choirs. Sadly, that pastime ended when her voice became constantly strained and hoarse, as if she had a bad cold.
It's been a real difficult journey at times. For one thing, when people hear me talk, many times they think I have a sore throat, that I have a cold, especially when I'm talking on the telephone with people. They might say, "Oh, you must have a terrible cold." And I'll say, "I wish I did. I could get rid of that." And then I try to explain this.
The symptoms are really that vocal tremor, where it kind of has this like you're breathing in between your words. It's hard for me to pantomime that one, but it usually, instead of saying a nice e, it's e, kind of almost a vibrato, I guess. And with true spasmodic dysphonia, it'll do that even if you're doing like whispering. If you're going, it'll also go because they're always kind of fighting when you're trying to act like you're talking. It's kind of task specific. So if you're not talking, if you're not making noises that you're trying to communicate with, you actually don't have as much of that dysphonia.
Scientists aren't sure what causes spasmodic dysphonia, but they believe it's neurological and may have a genetic link.
And so it came to be that they found the gene marker on chromosome 9 that causes this tremor. So when I learned that, I asked my mother what she knew about family members whose voices gave them problems. And she said, "I don't know anything," but she said, "I think your grandfather, my dad, I think in his later years, he had kind of the same type of voice, and they just thought it was because he was old, I guess."
There is no cure for the chronic lifelong condition, but there are some treatment options.
And for spasmodic dysphonia, sometimes we use Artane or clonazepam sometimes to help with those extra muscle spasms. Now, all those medications have kind of, some systemic effects. They can sometimes make people tired, sometimes make people a little foggy headed, lower your blood pressure, but they're usually pretty well tolerated.
Pat and her husband George are world travelers, and that provides an opportunity to educate others about this condition.
But that's been another opportunity to visit with people around the world about this, because when we're trying to visit and I can tell they're, wondering why they can't hear me or understand me real well, that's kind of an open door for me to tell them my story.